Breaking the wall of predicting Alzheimer's. Yasmina Abakkouy, Falling Walls Lab Leuven.
Science is failing people with Alzheimer's disease. Yeah. We, as a human population, are failing them as well. Did you know that the number of individuals with dementia already exceeds the number of cancer patients today? And the worst part is Alzheimer's, which is the most common cause of dementia, is still perceived to be part of aging. And society just accepted that fate for the elderly population. By 2050, the number of individuals with Alzheimer's is estimated to triple in number, accounting for 150 million individuals worldwide. There's currently no treatment that stops or even slows down disease progression, resulting in an increased mortality exceeding cancer mortality. In addition, clinical trials know a long history of failures. And one of the main reasons is a lack of knowledge and the lack of tools to correctly stratify individuals. And that's where I come in. Alzheimer's, as a complex neurodegenerative disorder, has many different underlying causes. This may imply that some therapies may only be effective for specific groups of patients. I use polygenic risk scores, PRS, to help identify these individuals at risk in the first place, whether they have a high risk for Alzheimer's or a low risk for Alzheimer's, and to correctly stratify them in these specific subgroups. So before I explain polygenic risk scores any further, we need to take a step back. We are all for 99.9% genetically identical. Wow. So the 0.1% genetic differences, called genomic variants, are what make us unique. It's why I have brown eyes. Some of you may have green eyes. It's also why someone is predisposed to disease. Well, in Alzheimer's, there are many genomic variants known to be associated with disease. This is simply, these genomic variants are more frequently present in people having Alzheimer's compared to healthy controls. But the genomic variants on their own do not predict an individual's risk to disease. By combining hundreds or thousands of these genomic variants and their small effect sizes in a score, an individual's risk to develop Alzheimer's disease is explained. So these polygenic risk scores can aid in early diagnosis and better stratification for clinical trials. So by really focusing on the genetics of Alzheimer's disease, new research approaches can be explored. So no, your grandmother is not just old or senile, she has Alzheimer's. Let's not fail her.